The test item cluster for patients with mechanical neck pain likely to benefit from thoracic manipulation include symptoms less than 30 days, no symptoms distal to shoulder, looking up doesn't aggravate symptoms, FABQ physical activity score less than 12, and diminished upper thoracic spine kyphosis, as well as cervical extension range of motion less than 30 degrees. All right, if you could just go ahead and do this motion. And back down. Gonna measure it now. And go ahead. Very good. The test item cluster for subacromial impingement syndrome includes 3 tests. The first is the Hawkins-Kennedy test. So I'm going to make my patient go to 90 degrees of shoulder flexion, then I'm going to forcibly medially rotate her arm. A positive sign is if she has pain during this motion. Second is the painful arc sign. So I'm going to have my patient actively raise her arm in an abduction. And a positive sign is if she has pain within 60 to 120 degrees. The last is the infraspinatus muscle test. What I'm going to do is have the patient in a neutral shoulder with their elbow at 90 degrees and apply a medial force. And if she is unable to resist against me or has pain, that is a positive sign. The test item cluster for full thickness rotator cuff tear includes 3 tests. The first is the drop arm test. So I'm going to have the patient shoulder abduct to 90 degrees, and I'm going to let go, and she needs to slowly lower the arm back to her side. Go ahead. All right. If she is unable to do that motion, that elicits a positive sign, or if she has severe pain that causes her to drop suddenly, that is also a positive sign. The other 2 are the painful arc sign, as well as the infraspinatus muscle test, which you have seen previously. The test item cluster for mechanical neck pain that benefit from cervical manipulation includes patient symptoms less than 38 days, patient's expectation that manipulation will help, cervical rotation range of motion with a difference of 10 degrees or more from left to right. So I'm going to measure that now. Alicia, go ahead and look to your left as far as you can. All right. And now look to your right as far as you can. Okay. And then finally, you want to do a posterior to anterior mobilization. And if they have pain with that, is with the test item cluster. Again, this is in the mid-cervical spine. The test item cluster for cervical radiculopathy includes 4 things. The first is a positive upper limb tension test for the median nerve. Go ahead with your right ear to your shoulder, side bend, and to the other side. A positive sign would include numbness, pain, or tingling. Now I'm going to do a distraction test. And a positive sign would be if she has a relief in her symptoms. Next, I'm going to do a Sperling's test. I'm going to look into the mirror and check for any pain or facial expressions. Go to the same side, or affected side. All right. And then last but not least, we would check cervical range of motion for rotation, which we did previously, and she needs to have less than 60 degrees. For the upper limb tension test 2B, it focuses tension on the radial nerve. So first you're going to have the patient supine. You're going to have their arm abducted 10 degrees with their elbow at 90 degrees. What you're going to do is depress the scapula with your hip, and you're going to lower their arm into elbow extension with wrist flexion and finger flexion. Differential diagnosis of a rotator cuff tear or shoulder impingement versus either a C5 or C6 radiculopathy. For a rotator cuff tear, you might expect to see limited active range of motion but full passive range of motion. You would expect to see a positive drop arm sign, a positive infraspinatus muscle test, a positive Hawkins-Kennedy impingement sign, a negative distraction test, a negative upper limb neurodynamic test, a negative Sperling's test, but normal reflexes and sensation. For C5, C6 radiculopathy, you would expect to see a positive distraction test, positive upper limb neurodynamic test, positive Sperling's test, positive shoulder abduction test, a negative Hawkins-Kennedy impingement sign, limited cervical rotation range of motion to the ipsilateral side. For C5 radiculopathy, you would expect to see deltoid weakness, sensory loss in the C5 dermatome, which is in the shoulder area, and diminished bicep reflex. And in the C6 radiculopathy, you'd expect to see bicep and wrist extension weakness, as well as a sensory loss in the hand, in the C6 dermatome mimicking carpal tunnel, as well as a diminished biceps reflex. The load and shift test is used primarily to check for atraumatic instability of the glenohumeral joint. First, you're going to grasp the head of the humerus and center it into the glenoid fossa. Then you're going to push the humerus anteriorly and posteriorly, noting the amount of translation and end feel. Differences between the affected and normal side should be compared. The active compression test of O'Brien is used to detect a superior labral tear. So what you do is have the patient go to shoulder flexion of 90 with 10 degrees of horizontal adduction and a medial rotation with their thumb down towards the ground. You're going to apply a force, and then you're going to have the hand up supinated and then apply another force. And a positive finding is if they have pain in the first position and not the second. The lift-off sign is checking for subscapularis weakness. You're going to have the patient place their hand on their back pocket and have them lift off away from their body. And since she's able to do so, I'm now going to apply a force. Go ahead and lift off and resist against me. A positive finding is if she had weakness or pain during this motion. The supraspinatus or empty can test is used to detect supraspinatus tendon or muscle pathology, as well as neuropathy of the suprascapular nerve. First, you're going to have the patient abductor arm 90 degrees with their hand in neutral. You're going to apply force. Then you're going to perform this in scaption with her thumb down for the empty can and apply a force. And a positive finding would be if she has pain or weakness.